and today I am going to present the topic fluoride in drinking water. Is it good or bad? Slide 2. Fluoride exposure and absorption. The major sources of ingested fluoride are water and other dietary sources including tea, food and drinks prepared with fluoridated water. Fluoride tablets and drops and other supplements and unintentional ingestion of fluoridated toothpaste, especially by children, or fluoride mouth rinses. In addition, some individuals are exposed to fluoride occupationally or receive therapeutic dose of fluoride, for an example in the treatment of osteosclerosis and osteoporosis. Some estimates for adults and children of fluoride ingestion from drinking water, toothbrushing and diet are mentioned in slide 3. Safe water fluoride level can be up to 1.2 parts per million. Fluoride paste contains 1000 to 1500 parts per million of fluoride, which can cause acute toxicity if accidentally ingested. That's the reason you can see the warning on fluoride toothpaste asking to contact emergency services if accidentally ingested. Now slide 3. Daily fluoride consumption from drinking water, toothbrushing and diet. You can look at the figure. Now slide 4. Chronic health impacts. Now first I am going to discuss about dental caries. Fluoride prevents or modifies the process of tooth decay. There are currently thought to be three main ways by which fluoride modifies the process of tooth decay. First of all, improvement of the chemical structure of the enamel during development, making it more resistant to acid attack. The encouragement of remineralization with an improved quality of enamel crystals and reduction of ability of plaque bacteria to produce acid. It also improves or enhances the chemical structure of the enamel during development. Increase in remineralization, which reduces the ability of the plaque bacteria to produce acid. Water fluoridation is effective in reducing dental caries. Slide number 5. Dental fluorosis. Dental fluorosis is a form of developmental defect of tooth enamel. It ranges from barely visible white striations on the teeth to gross defects and staining of the enamel. Dental fluorosis is caused due to high concentration of fluoride in drinking water, and there is a dose-dependent relationship such that you can see more cases of dental fluorosis with higher level of fluoride concentration. Slide 6. Bone health. Excessive exposure to fluoride causes an arthritic bone disease called skeletal fluorosis. In the advanced stages, fluorosis can resemble a multitude of bone joint diseases, including osteosclerosis, osteomalacia, and osteoporosis. Excessive water fluoridation can increase the risk of hip fracture, but available evidence suggests no effect and further study is required. Slide 7. Cancer. Current evidence does not support the hypothesis that water fluoridation increases risk for cancer, but it might has some genotoxic and mitogenic effects on osteoblasts. There is a need for more rigorous studies to analyze the effect of fluoride on osteosarcoma. Slide 8. Effects on reproduction and birth defects. Adverse effects of high fluoride intake can be reduced lactation, but this effect requires high fluoride concentration, which is higher than those in fluoridated drinking water of humans. Fluoride can be associated with increased incidence of birth defects like Down syndrome. Renal effects. Slide 9. High fluoride ingestion such that in excess of 12 mg per day can cause adverse effects on kidneys. Renal clearance decrease in persons with renal insufficiency or diabetes mellitus, so they are more susceptible to adverse reaction caused by fluoride. Slide 10, gastrointestinal tract. Fluoride can be irritating to gastric mucosa, resulting in dose-dependent adverse effects. Gastrointestinal effects are not a problem at optimal drinking water fluoride concentrations. Gastric irritation is due to hydrogen fluoride at high doses of fluoride intake. Effect on intelligence and thyroid gland. There is a positive association between high level of fluoride in drinking water and decrease in IQ. High fluoride level can cause goiter in association with low level of iodine. Other outcomes associated with high fluoride intake in drinking water are senile dementia, anemia during pregnancy, sudden infant death syndrome, and primary degenerative dementia. Indirect effects. There can be toxicity due to other substances added to water with fluoride. There is an effect of fluoride on uptake or absorption of metals in gut, which can increase risk for adverse health effect. Fluoride in water can increase the leaching of aluminium from utensils. Conclusion. My conclusion is that fluoride in much lower concentration from 0.7 to 1.2 parts per million used in water fluoridation is not harmful. Instead, it has some protective effect on tooth decay due to caries. Natural fluoride concentration is higher in some places, which has number of adverse effects on health, which I have discussed in previous slides. Most of the adverse effects occur at very high concentration of fluoride in drinking water, say for an instance above 25 to 30 parts per million. So it's an ongoing debate whether to use fluoride in drinking water or not. So thanks for watching my presentation, and I welcome your suggestions and your doubts. Thank you.